Welcome back to Insight. We're at Goshen Center for Cancer Care with Dr. Schwarz, and we want to talk about what makes you guys different and sets you apart.
Yeah, we are a comprehensive cancer center where all the advanced and cutting-edge tools and techniques are essentially assembled under one roof. We're working very closely together with multiple disciplines within the oncology field, surgical experts, medical oncologist experts, radiation oncology experts, and multiple others, including naturopathic oncologists, who all consult on patients and their complex cancer care needs and bring in their expertise into a group concept how to best treat this disease. And it's all done, in fact, under one roof in one building.
And I think you guys were way ahead of the curve in establishing this whole notion of all the equipment and all the experts under one roof in our region, certainly.
Yeah, this has been established more than 15 years ago, and the Goshen Center for Cancer Care has been the first comprehensive cancer center in northern Indiana in that setup.
So as a patient, what does that look like then? What are the advantages if I walk in and maybe I'm coming here for a second opinion and I learn what the treatment is going to, how's it going to look different, I guess?
Yeah, so patients come with very individual and specialized cancer care needs, and to sort out what is best for the individual patients is, in fact, one of the strong points of our approach. The patient would come, would be offered the appropriate initial consultation, and would be offered all the expert interactions to assess their cancer care needs, subsequent discussions and treatment planning, all in a group, so-called multidisciplinary group setting. And the patient would be offered supportive care expertise for spiritual and mind-body counseling needs, for various other sources of supportive care that one may encounter during the course of the treatment. And we have experts for all of those needs within our group.
I don't want to put words in your mouth, but it almost sounds like you're saying here at Goshen you're able to treat patients, not treat cancer, because everything is going to be unique.
Yeah, of course, the patient and the family members are at the center of this. And what's most important is that we make our contribution to make the patient live as well as possible with their disease during the treatment and after the treatment has been completed. So living life at the best level despite the challenge of cancer is our mission, and I think we're very good at this.
So, all right, if people are interested in getting that second opinion, obviously if they're coming from Fort Wayne, this is a great regional destination that's close, that's cutting edge. How simple a process is that?
I think the patient can call in. It doesn't need a physician referral, but that's possible too. So the patient can call, make an appointment, and we essentially handle it from there. We, in fact, know how to acquire the relevant studies and test results, et cetera, and assemble it all, and we'll welcome the patient within a very short amount of time.
So what excites you as far as treatment goes here? Is there anything coming down the road that the cutting edge things that you look forward to bringing to patients?
Well, that depends very much on the different disciplines. I'm a surgical oncologist myself, so we do complex operations and we do it rather well. But every discipline has basically evolving techniques and promising results. There's cutting-edge radiation technology that we have here that is fairly unique within the region. We have access to clinical trials, so cutting-edge chemotherapy, or in more modern times, immunotherapy, which is kind of the big wave in improving cancer care. So all those tools are here, and how to put them together for the best effect for the individual patient's needs, that's our duty and our mission.
If you want to learn more about Goshen Center for Cancer Care, go to livestouched.com. We'll be right back on Insight.